Good evening.
Right. So before we are going to start the training session, I just want to make a small announcement that please make sure that there is no disturbance around you because we are going to do a lot of practical things, and for those things you need to have a silent and calm environment. So please make sure that I'll give you 2 minutes of time. Please make sure that there is no noise around you which distract you from this learning. So within the 2 minutes, you can saturate all the things around you. After 2 minutes, we are going to start the session as usual. Thank you. All right, once again, welcome back. So I hope you all have saturated all the things around you. All right. Now, once again, welcome to WTL Center for Excellence and Happy Learning. Today, we are going to talk about a complete guide for diabetes and high BP. All right. So, my name is Pramod Kumar. I'm an international certified trainer. Before we are going to start the session, I just want to ask you all a simple thing. So, what are the prerequisites for this program? So what are the prerequisites for this program? So you can unmute yourself and you can make it a two-way communication. So I want to hear more from you all. So what would be the prerequisites for this program? So let me tell you, the first prerequisite is making a comfortable seating. There should not be any disturbance. There should not be any distractions while you are participating in this discussion. In this one-day webinar, there should not be any kind of distractions and disturbances around you. So that is the first prerequisite. And then the second prerequisite is you should have a clear idea about your lifestyle. And the people who are suffering from diabetes and high BP, they are, it is a custom for them to go and visit a doctor every now and then, and they, if you say simply, it might be like they might be vexed with usage of medication every day. So are you really want to live a medicine-free life? You can give me the answers. So are you really want to live a medicine-free life? Or are you really make out your mind for change? Or are you ready to make a change in your life? Or are you ready to give your 100% participation, 100% efforts, whatever we are going to learn in this webinar? And are you ready to start now? If your answer is yes, please comment in the chat box, yes. If you're all ready to start the program, please comment in the chat box, yes. Please comment in the chat box, yes. So if you're all ready to go with this program, please comment in the chat box, yes. I got only one answer. Okay, I consider it yes. Yes, yes, very good. So, first, objectives of this program. Let me share some objectives of this program. So what are the objectives we have to start this program? So after attending this program, all the participants are able to learn to identify their focal areas to be fit and healthy, and they are able to learn to find out the reasons causing ill health, and you'll be able to learn to manage their diet as per the requirement, and you will be able to learn to manage their emotional imbalances, and you will be able to learn to cope up with various therapies and methods to be fit and healthy, and learn water therapy for better metabolism, and learn ideal diet plan. Not only all these things, and you are going to learn various exercises for reduce and produce. So this is the slogan we want to use for all the program, reduce and produce. So the course overview. So what kind of things you are going to learn? So what are the things are awaiting for you all to improve your different, to cure yourself and to improve your lifestyle? The first thing is meditation for managing the stress. Meditation for managing the stress. And the second concept is anchoring technique for lifetime happiness. And the third thing is water therapy for better metabolism. And then the fourth thing is estimation of calorie burn. And then the fifth thing is calculation of BMI. BMI is nothing but body mass index. And for understanding BFP, so BFP is nothing but body fat percentage. And calculating the intensity on amateur. Amateur is nothing but maximum heart rate. And methods of measuring THR. THR is nothing but target heart rate. See, if you practice to maintain or if you practice to set your own target for your heart rate, that's also can be possible if you learn this course, if you attend this course, automatically you also can be able to dictate your heart to give you the correct results. And concepts of reduce to produce and ideal diet plan for Indian community. So here we are going to provide you an ideal diet plan for Indian community. And the last point, but not the least point, ideal 8-week exercises for a healthy life. So these are the course contents we are going to discuss. This is nothing but the course overview about the course. This is what the courses we are going to learn and we are going to practice. All right. So let me talk about point one by one in detail. So meditation for managing the stress. So most of the people, whenever you get any kind of illness or whenever you get any kind of ailment, so generally, rather than the effects of the illness, rather than the effects of the ill health, the feeling of fear to the disease, the feeling of the fear of that kind of ailments create a lot of damage to your health, a lot of damage to your total body. So before you are going to treat your health, before you are going to treat your ill health, you should know how to treat yourself in the form of mentally, how to manage your mental imbalances. So we need to be able to manage our imbalances mentally. Once you are able to manage your imbalances, then automatically you will be able to cope up with all the diseases. That is why we are offering the program called meditation for managing the stress. So there are a lot of different styles, there are a lot of different approaches to manage the stress and all. So we are going to discuss all those things to live a happy life. And the second concept is anchoring technique. See, if you observe your life, now you are facing some difficulty, now you are facing some ailments, that's why you are feeling a little bit distracted, a little bit disturbed, a little bit, you are dragging or you are pulling down. So these kind of feelings generally will be there when a person is suffering from any ailment. But let me tell you, before this incident or before this ailment or before this disease, definitely you might have a wonderful life. Correct? So what we are going to do in this anchoring technique is you are going to decide your life how it should be now onwards. So whatever the happy life, whatever the past happy life you had, the same or the similar happiness you are going to bring back to your life. That is what the concept we are going to learn under anchoring techniques for lifetime happiness. And then the third step, water therapy for better metabolism. This is the very important key aspect to be fit and healthy. See, most of the people who doesn't know how to use the water therapy, who doesn't know how to drink water, who doesn't know how to use the water as a medicine, those people only get infected, or those people only get affected by a lot of diseases. So let me tell you one simple thing. According to the Vedas, or according to any mythologies, old mythologies, water is elixir of life. If you refer the meaning of elixir, the word elixir, it gives you complete meaning. That is, it's a nectar. All right, it's a nectar. It is the key source for your life. So what we supposed to do is, we supposed to understand the water therapy techniques and how to use the water for our concept. So this is what we are going to practice. All right, and not only these things, we are going to learn estimation of calorie burn. So do you have any idea about how much calorie you are burning every day? How much calories you are burning every day? So this is a huge and big question. Most of the people doesn't know this concept. Once you know how much calories you are burning every day, then automatically you'll have a clear idea about how much calorie you are intaking, how much calories you are taking in. Once you know these two concepts, like how much calories you are burning every day and how many calories you are intaking. So this is a wonderful concept where you can understand the whole life, or you can easily understand that the metabolism of your lifestyle. Once you understood this concept, once you understood this concept of estimation of your calories, then automatically you can stay fit. Once you stay fit, no doubt, no disease is dead enough to attack you, because your immune system is powerful enough. Most of the people, why they are falling sick every now and then, is just because of one reason. That is nothing but the way they are intaking the calories. They are not aware of the calories. Once you use more calories, once you intake more calories, then automatically that energy is going to be that energy is going to be stored in your body in the form of fat. Once you know your calories, then automatically you'll be able to identify BMI. So here you can see what exactly does it mean by BMI, body mass index. You should be able to understand what exactly does it mean by body mass index. That is nothing but your weight and your height. Most of the people, they are not maintaining proper body, right? So according to the human body, there are three types of body structures. One is ectomorph, and the second one is mesomorph, and the third one is endomorph. All right. So the ectomorph means very lean, very thin. They are like, they're already infected with a lot of diseases. They looks like they are already infected with a lot of ailments. And we can, most of the people, they used to comment on them because of their skeletal body, right? They looks very skinny. And the second type is mesomorph. Mesomorph is the normal body shape where you can find the broader shoulders and narrower waist. And the third one is ectomorph. This is the most of the people have been in settling themselves into the endomorph. So the endomorph structure is like it's a oval shape, all right? So huge tummy, fatty body. If you observe these kind of people, the fat has been stored not only in their belly, and it's being stored in their arms, and it's being stored even in their legs, like thighs. All right. So this is a very huge problem. Nowadays, most of the people are facing a huge problem. Nearly 60 to 70% of people are facing only problem is high excessive weight or obesity, we can say simply. Because of that obesity, we are getting a lot of diseases. Among the diseases, the more and the more dangerous diseases are diabetes and high BP. These are the two diseases generally affected, or these are the two diseases generally happen to a common person when they are obese. Or of course, there are some other certain reasons. We are going to discuss them all in detail a little later. Right now, we are going to identify your BMI. When you know your BMI, then automatically you will be able to understand the concept of body fat percentage. If you know the body fat percentage, every human being, according to their age, according to their height, according to their weight, they're supposed to maintain certain levels of body fat. If it increases, it creates a lot of ill health. So how we are going to estimate body fat and how we are going to reduce the body fat? These are the concepts we are going to discuss under the fifth point. And that's the sixth point. Calculating the intensity and amateur. First of all, let me talk about intensity. So the intensity means intake, the capacity of intake of oxygen. Simply, let me tell you in general words, intensity is the capacity of your lungs. The capacity of your lungs. So how much oxygen your lungs are using, how much oxygen your lungs are gathering and circulating to your body cells. This is what called intensity, right? And we are going to learn MHR. So MHR is nothing but maximum heart rate. All right. So most of the people who are suffering from high BP, that is just because of the maximum heart rate. Based on this maximum heart rate, we are going to decide whether you are high BP or low BP or a normal person, right? So this is what the concept we are going to learn. So you yourself, you're going to learn all these techniques. Let me tell you one wonderful thing about all this course. That is, after attending this program, you don't need to consult any doctors. You don't need to consult any technicians to know about your body. Of course, if you get any ill health, we're supposed to consult the doctors. But in these cases, if you have clear idea, so if you ask me, in the registration link already mentioned that prerequisites, some prerequisites. So what are the prerequisites I mentioned? Let me recite it for you all. The prerequisites are, you should have a clear idea about your body, and you should have a clear idea about your ill health, and you should have a clear idea about how much percentage and what is the rate or what is the ratio you have been suffering from, which means you should have, or we should diagnosed by the doctors at least a couple of months ago, or at least before a month. So this is what the concept I mentioned in that registration form. I don't know how many of you have clear idea about your body, and I don't know how many of you have a clear idea about your diagnosis. All right. So if you know all these techniques, you can diagnose yourself. So what is your drawback and what are your expectations, how to reach them? The complete pathway you are going to learn in this program. And methods of measuring the THR. This is a wonderful technique. I love this topic, THR, target heart rate. See, if you talk about NLP or if you talk about CBT, most of the people, they focus on their brains, and they used to say, all the NLP master trainers or NLP trainers or CBT trainers, or simply we can say psychologists, they used to say one wonderful statement that how to change your mind, how to get control over your mind. Similar way, here we are going to get complete control over your heart. How to train your heart to function well. This is what the concept we are going to learn under methods of measuring the THR, and concepts of reduce to produce. So this is a key component for all these points, reduce to produce. If you reduce a lot of things, then automatically you will be produce a lot of different concepts. We are going to learn this reduce to produce a little later, just in a fractions of minutes. We are going to learn that. And now the next point is, ninth point is ideal diet plan for Indian community. So if you browse the internet, or if you browse any internet sources or YouTube's, mostly you will get a lot of diet plans. But here you are going to learn complete 1 week diet plan. Don't ask me, sir, after 1 week, what should we eat? All right. So whatever the diet plan we are going to provide you, with that diet plan, you can modify little, but it should not be beyond the calorie limit, and it should not be the foods whichever you are going to be restricted. So the foods whatever we are going to suggest you, those foods only you supposed to take, which means you should have a complete control over on your food. Let me tell you a wonderful statement given by a great dietitian. The person said about the food. All right. So every human being eat to live. We are eating for the survival. Correct. So, but he used to say one statement: you can eat for living, but don't eat more to die. If you eat more, then automatically you'll get a lot of diseases. All right. It doesn't mean that you should not eat tummy full. You can eat tummy full. You can drench your all the desires. All right. But what we supposed to do is be careful. Whatever you are going to eat, you can eat anything. You can do anything. You can, you know, whatever you want to eat, whatever you want to do, you can do it. But be careful that whatever you are going to do, whatever you are going to eat, that's going to decide your lifestyle. Those are the things are going to decide your lifestyle. So never allow your food habits, or never allow your food items to decide your lifestyle. So be careful with food items. And next, the last point is ideal 8-week exercise for healthy life. So here we are going to give you wonderful healthy exercises. So let me ask you a simple question. So when I say this one, exercises for healthy life, how you people are feeling about it? What are the things you are getting into your mind? Please mention in the chat box. So what are the ideas you are getting into your mind? Please mention in the chat box. Walking, yoga, wonderful. Any other concepts? I request all the participants, please make use of the opportunity to communicate, because if it is the simple webinar that I'm going to dictate you, then it will be like a different one. But here we are going to practice together. So try to use this opportunity. Yoga, warm up, wonderful. Walking, yoga, wonderful. Any other concepts? Food control, superb. All right. So here we are going to give you complete 8-week exercises for healthy life. You can use these exercises. No need to go to, yes, brisk walking, cardio, super, wonderful, wonderful, food control, super. All right. So here you are going to learn all the simple techniques. Simply staying at your home, you can do all these exercises. No need to go to any fitness centers, no need to go to any gyms, or no need to go to anywhere. Even you don't need to go to the parks. Staying inside your house, you are going to do a lot of wonderful exercises which can give you tremendous results. You can't believe the results after 8 weeks. If you take the complete 8 weeks training, then automatically you are going to see the results, wonderful results, which you couldn't be believe yourself, the tremendous change which is going to happen in your life. All right. So now let's come to the topic. First of all, let me talk about it. What exactly does it mean by diabetes? So most of the people are suffering from diabetes. We all know that, right? So what exactly does it mean by diabetes? So if you go to the doctor, they'll do some tests, they'll diagnose your blood, right? They are diagnosed to you, then they'll say that you are affected diabetes type 1 or type 2, your choice, right? So according to uh, the infection or according to your ailment, they are going to give you the type 1 or type 2 diabetes. All right. So first, we should have a clear idea about diabetes. What exactly does it mean by diabetes? Diabetes is a disease that occurs when the blood glucose or blood sugar is too high. When your blood glucose increases, when the blood glucose is very high or too high, that situation, that scenario can be called as diabetes. And the blood sugar level less than 140 mg by dl is the normal way. If you have 140 by 140 mg for dl, then it is normal. If the reading exceeds, if you have more than 200 mg for dl, then that is nothing but high diabetes, high blood sugar in your body. Okay, so a reading between 140 to 199 mg per dl, it is indicates pre-diabetes. Sometimes if when you check your blood sugar levels, if you get 140 to 199, so don't decide on based on one test sample. Try to take two or three random samples, like before eating food, after eating food, all right? So after one day like that, so if you take two or three samples together, if you get the similar results between 140 to 199, that indicates you are about to attack diabetes. Okay, so it is, the situation can be known as pre-diabetes. All right, and blood glucose. So we have been talking about the increase of glucose levels in your body. So what is glucose first? We should understand this. So the glucose is the main source of energy and comes from the food we eat. So this is a main energy source in our body, which can give you a lot of strength to perform all our actual daily chores. So if you want to perform a lot of activities, if you want to do any work, you should have some energy in your body. That body generally comes from the food whatever you are eating. All right, let me give you the clear idea. Just now I said that the energy is coming from the food you are eating, correct? The food whatever you are going to eat, that food is going to give you the energy. That is what called sugar, blood sugar, right? So if the blood sugar increases, that process, that thing called as diabetes. So you can easily understand that diabetes is the actually happening just because of the food intake, the unhealthy food habits, or the food intake whatever we are putting inside, that is going to give you a lot of sugar. Once the food produces a lot of sugar, that is going to be gathered into your body. Once that blood sugars gather into your body or in the blood, that process, that phenomenon is called as diabetes. So we should understand what exactly diabetes. See, everything has a relationship. The way you are eating, the way you are living, everything decides your lifestyle. That's what I said just now. Whatever you want to eat, you can eat. Whatever you want to do, you can do it. But remember that whatever you are going to eat, that is going to decide your lifestyle. So be cautious about what you are eating. Whatever you are eating, that is going to create the glucose. That glucose is a main cause for diabetes. If the glucose levels increases in your body, that is called diabetes. All right, and insulin, a hormone made by the pancreas, helps glucose from food get into the cells to be used for energy. So whatever the glucose is there in your body, that glucose has to be distributed to the whole body. That glucose has to be distributed to your all cells, right? If the glucose distributed to the whole body, then automatically you can be able to do any work happily. But what happens? There is a hormone called insulin, right? All the diabetes people, no doubt about it, all the diabetes people are pretty aware of insulin, right? Because some, unfortunately, some people every day they used to take diabetes injections, like simply insulin injections every day. This is the thing where the life creates little difficulty and where the life creates little worrying and embarrassing, right? But no need to worry. We have a wonderful solution. We are going to solve all those problems in fractions of, in days of, or in a weeks of time. We are going to practice all the things together and we are going to see the results, wonderful results, right? So this is the insulin which can absorb the all glucose in your blood and it can distribute the glucose to your cells. But the problem here is whatever the glucose has to be distributed, if it is doesn't distributed to all the body cells or the whole body parts, then that is called diabetes. Now, so sometimes body doesn't make enough or any or insulin, right? Sometimes a human body could not be able to produce enough insulin, all right? So for example, in your body there are 100 sugar cells, right? Or 100 sugar molecules in your body. If there is sufficient insulin in your body, what happens? Then automatically it will gather the sugar cells and sugar particles and it will distribute to the body. But there is no sufficient insulin. Then automatically what happens? For example, one insulin atom acting as a transporter, right? It's been transporting one sugar cell from one place to, from blood to the body, from blood to your cells, right? It transported. You have 50 insulin molecules in your body, but there are 100 molecules of sugar in your body. What happens? The 50 insulin molecules catch all the 50 molecules of sugar and it is going to distribute. The rest of the 50 gathered, coagulate in a place. They'll be floating simply in your blood. That process causes diabetes. So glucose then stays in the blood and doesn't reach cells. Over time, after a few days, if the same phenomena, 50 cells of sugar, 50 molecules of sugar, gathering. One day, no problem. 2 days, no problem. 1 week, no problem. 1 month, maybe a problem, right? So, if the sugar has been gathering into your blood over time, it is going to create a lot of health diseases, a lot of health issues. And although the diabetes has no cure, so don't afraid while looking at this statement, diabetes has no cure. You should understand that diabetes has no cure. There is no 100% permanent solution. You can't cure it. You can't take out that sugar from your body. You can't take that diabetes from your body. But you can take steps to manage your diabetes and stay healthy. You don't need to take out the diabetes from your body, but you can manage yourself to stay fit and healthy without any complaint. All right? So that is what the concept you are going to learn. right? Sometimes people call diabetes a touch of sugar or borderline of diabetes. These terms suggest that someone doesn't really have the diabetes or has a less serious case. But remember, every case of diabetes is very serious. It should be, it should be treated on time. If you don't treat diabetes on time, you can be able to control the state circumstances. Like once you infected diabetes, you are more vulnerable than the children. See, if you talk about the small kids, right? So they are more vulnerable, they are more sensitive, correct? Because they newly entered into the world, they are new to this atmosphere, they are new to the germs, they are new to the lot of bacteria and virus and fungus. All right. So the baby is vulnerable, but the person who is suffering from diabetes is more vulnerable than the baby. Because if a person infected with diabetes, then automatically what happens, that is going to reduce your immunity power, that is going to spoil your actual strength. So there you're supposed to boost your immunity. Once you boost your immunity, then the diabetes also can be do anything. It will be stabilized, it can do anything, and it will be normal position. All right. So this is what the best thing what we can do. And the most common types of diabetes. There are two common types. There are two most common types of diabetes, or type 1 and type 2. So let me know how many of you are infected with diabetes 1, how many of you are suffering from diabetes 2. You please mention in the chat box. Please mention in the chat box how many of you are suffering from type 1 and type 2. If any rare conditions, if anyone facing type 1 and type 2, that also can be mentioned. Okay. Okay, right. So let me give you the clear idea about what exactly does it mean by type 1, what exactly does it mean by type 2. Once you come to know that, then it will be easy for you to solve the problem. See, whenever you want to solve any problem, whenever if you want to find a solution for a problem, the first step to solve the problem is to find out the problem. Once you have a clear idea about the problem, then automatically you will be able to solve the problem without any hesitation, without any stoppings. All right. So now let me give you the types. First type, type 1. What exactly does it mean by type 1? The body doesn't make insulin. The type 1 diabetes is they are not able to produce the insulin. Actually, it is an enzyme has to be produced in our body. But unfortunately, maybe there are a lot of reasons for that problem. We are going to come to that part a little later, right? So because of various reasons, the person who is not able to produce the insulin, sometimes they produce the insulin, but it's not sufficient. It's not enough to survive. It's not enough to utilize for the whole body. This phenomenon, this situation called type 1 diabetes. So these people, the immune system attacks and destroys the cell. So the people who are suffering from diabetes type 1, their immune system attack on their own body cells. Because immune system is like a soldier, right? Immune system is like a soldier of your body. If it doesn't have any work, what happens? Whatever comes in front of them, whether they'll become completely passive or they'll become aggressive. We can be able to decide with the immune system. So it is going to attack our own body cells. This is what the problem with type 1 people. And The type 1 diabetes is usually diagnosed in children and young adults. It doesn't mean that only the children and young adults has to show this problem. Anyone can be affected with type 1. All right. And people with type 1 diabetes need to take insulin every day to stay alive. This is the situation. This is the statement I don't want to be there in anyone's life. All right. So if you want to live happy life, if you want to stay fit, you should decide what to do, what not to do. But here, unfortunately, the medicine, the insulin has been deciding, it's been deciding your lifestyle. So this is where I felt really distracted with this statement. All right. So if you're really suffering from type 1 diabetes or type 2 diabetes or high BP or whatever the problems, all right, so try to practice the methods, whatever we are going to learn in this training. Once you practice all these concepts, then automatically you will be able to lead your life happily. All right. So all the great old good days will return to you. They're all awaiting for you. Right. So try to work hard a little. Now, type 2. So the type 2 is the body does not make or use insulin well. So the type 1 is they can be able to produce, but here it is can be able to use that insulin. It can be able to produce, or whatever the amount is producing, it's not being using. This is the process of type 2 people, right? They can be able to use the insulin, whatever there in their body. And when we can develop type 2 diabetes at any age, even during childhood also. All right. And however, the type 2 diabetes occur most often in middle-aged and elderly people. All right. So this is type 2 diabetes is generally, it's a common phenomenon in middle-aged people. All right. So I'll tell you the people, what kind of people they'll get, and what are the types of problems they are going to face. Everything we are going to learn here. All right. And type 2 is the most common diabetes. It is a most common diabetes type. Nowadays, most of the people who are suffering from diabetes, they are showing type 2 diabetes. All right. And there is another type of diabetes that is called gestational diabetes. This is the gestational diabetes only for the pregnant women. All right. So this is the diabetes generally happens with pregnant ladies, pregnant women. All right. So gestational diabetes is a condition in which a woman without diabetes, again I'm saying it's not complete diabetes, without diabetes, they develop high blood sugar levels during pregnancy. They are not diabetic patients, but the blood sugar increases. All right. And gestational diabetes is caused by not enough insulin. If you observe the whole story of diabetes, it's just only one factor, that is only one deciding factor. That is nothing but insulin. All right. So insulin generally produced by the pancreas of your body. It is a small organ in your body. All right. So the pancreas could be able to produce insulin enough for every human being. But why it is not able to produce? You should be able to be aware of that. I have given the pancreas, but I'm not able to produce, right? So I'm not able to produce the insulin enough. Why? We are going to practice that. We are going to learn. This is what I said, right? So I'm going to give you a wonderful concept, how to reduce, how to produce all these things, right? The usual onset is most common last 3 months of pregnancy. First trimester, this problem is going to be solved for pregnant women, but not type 1 and type 2. So the type 1 and type 2 can last forever. Sometimes it's, we can be able to control it. Again, I'm telling you, If you're not able to control your diabetes, in the sense you are not controlling yourself on food. Not only on food, you're not able to control yourself on your movements. So these are the general reasons why we couldn't be able to produce insulin enough in our body. All right. So now, so far we have been talking about diabetes. Now let's focus on high BP also. All right. So diabetes and high BPs are, they are like cousins. They mostly, some people infected both, unfortunately. All right. So a couple of days ago, I was told by a man, when I given this advertisement, he asked, his wife has been infected with diabetes and high BP. But at that point of time, without knowing the situation, I just I just made a statement. I felt real bad about that statement. I just made a statement like, it's a double dhamaka. But when I came to know that his wife is in ICU, I felt really bad about that statement, because see, the small things, if you change the small things, it just such a small things, tiny parts of your life. If you change those small parts, if you just change small things of your life, then you can see a huge difference, a wonderful, tremendous difference in your life. All right. So now let me talk about high BP, a condition in which the force of the blood against the artery walls is too high. All right. We all know that our blood has been pumping through the vessels. Right. So the nerves, whatever the nerves we are being, the blood has been flowing in your body. If the blood vessels are facing any high pressure, see, for example, there is a small water pipe, all right? So you just turned on your motor, there is a small water pipe. The water is, for example, if the water is a little low, then automatically the flow of the water is also simply normal. But what happens for the people who are suffering from high BP, that blood flow will be, the pressure will be very high, right? So that pressure, if it is huge, a little big vessels are big veins, then it will be somewhat fine. But in our body, there are certain vessels, blood vessels, very small in the size. If the blood forcefully goes and attack that vessels, then automatically what happens? Those veins are going to be ruptured. Those veins are going to be, torn into, right? They are going to rupture, or they are going to torn into small pieces. It leads to huge damage to the human life, right? So generally, the people who are facing high BP, they are also more vulnerable. And these people, generally, if the rate of high BP increases more and more, then automatically they are going to, unfortunately, they are going to coma also. So this is a huge problem which can be solved. Again, I'm saying, whatever the problem, there is no problem without any solution. But the thing what we need to do is we need to find out that solution. All right. So if you are ready to find out the solution with me, definitely I'll show you a wonderful path. All right. And usually hypertension is defined as blood pressure. If a person has been in a hypertension, excessive tension, that person, that situation, that feeling can be called as blood pressure. All right. So generally, the measurement is 140 by 90 is considered severe if the pressure is above 180 to 120. Okay. So the blood pressure is, if you are suffering from high BP, that scenario is you should have at least maximum you should have 140 by 90. If it reaches 180 by 120, then it is going to be dangerous. And high blood pressure often has no symptoms. But the diabetes people, they may show some symptoms like feeling dizziness, right? Feeling weak, exhausted, tired, right? These kind of general symptoms we can find in diabetes, but in high BP, we can be able to predict whether they are suffering from high BP or not, because it has no symptoms. It doesn't show more symptoms. And over time, if it is untreated, it can cause health conditions such as heart disease and strokes also. All right. And eating a healthier diet, with less, so don't tell this, less salt. This is the thing where most of the people feeling bad about their food. All right. But the truth is, whatever the food item you are eating, it has its own enough or sufficient salts. But without knowing that concept, what we are doing is we are adding extra salt. All right. So if you observe any cooking process, right, when they are talking about the salt process, when they are talking about the salt, they are saying simply salt to taste. All right. So whatever the salt you need, it's already there in your body. Whatever the salt you need, that's already there in your food items. But we are just habituated to add more salt, add more salt, add more salt. Now let me ask you a simple thing. How many of you love to eat packed food? Packed food. So the food items, whatever the food items you are eating from the packages like cans, right? So those are all nothing but completely heavily salt touched food. We should avoid such things. All right. So we should have a clear idea about our life. Once you know about your lifestyle, then automatically you will be able to find out wonderful solution for the problems. All right. So this is a right time to decide what to do, what not to do. Right. Next, what is high BP? According to guidelines provided by the Centers of Disease Control and Prevention Trusted Authority, normal blood pressure is less than 120 by 80 mmHg. If a person showing 120 by 80 mmHg, that indicates normal blood pressure. If it increases to 140 by 90, 140 by 90, then it shows that high blood pressure. If a person showing 90 by 60, that is low blood pressure. High blood pressure or low blood pressure, both are not safe for human life. And it is normal for systolic blood pressure to rise to between 160 and 220 during exercises. While you are doing exercises, it is quite common to a man to reach his blood pressure from 160 to 220. But if your blood pressure is going beyond 220 while doing the exercises, it's not advisable to continue your exercises. It's a good idea to consult your cardiologist. If you consult your doctor, then they will suggest you what kind of things you need to change. Right? But it can be happen with the athletes. It can be happen with athletes to reach even 250 also. But they are practiced on the time basis. Every now and then they practice. Just give me a second. All right. Now, so now I would like to talk about the problems with diabetes and high BP. Right? So don't worry, I'm not going to talk about the problem because you people are already pretty aware of all the problems because you know better than anyone else in the world about the problems which you are facing. All right. So I'm not going to talk about the problems, but I'm here to talk about the solutions. Okay. So here I have a wonderful solution for you all. The solution is reduce and produce. So this is the wonderful solution I have. I want to share with you all. So this solution is reduce and produce. So in the beginning, I asked you all to stay in a calm and quiet room. So I hope you all there in this calm and quiet environment. So if you are okay with that, then I would like to conduct a small practical thing. Now, all of you close your eyes. Just think about the things which you had very happily. Just think about the things which makes you very happy. Just think about the things when and where you spent your day or you spent your time very happy. You just think about it. Don't open the eyes, just close your eyes. Just close your eyes and try to think about the happiest moment of your life. You just think about the happiest moment of the life. Think about it. Think about it. Right. You are getting a little blur picture about your happiest moment. You got some blur picture. Now just deep enter into that picture. The picture should be clear enough. The picture should be clear enough. The background, the people who are with you at that moment, the things whatever made you happy, the dialogues made you happy, the background, the people's face, their dress, what kind of dress they wore, what are the colors at that point of time, what kind of dress you wore, what is the color. Just have a clear picture about it. You just have a clear picture about it. Get the clear picture. Get the clear picture. Now you are able to see the clear picture in your mind. You are able to see the clear picture in your mind. Just bring the smile on your face. Just bring the smile on your face. Bring the smile on your face. Now you are smiling. Now you're all smiling. The smile on your face, it looks like a beautiful roses. The smile on your faces looks like a beautiful roses. Your face glowing. Your face is glowing. Observe the pulse. Observe the pulse. Observe the thought process in your mind. Observe the blood flow in your mind. Deep dive into the mind. Deep dive into the mind. Enter into your mind. Observe your mind clearly layer by layer. Observe your mind clearly layer by layer. See the beautiful things in your mind. Feel the beautiful things in your mind. See the beautiful things in your mind. You are a man or you are a woman created by the God with all capabilities. You are the person given all talents. You are the one who has given all the blessings in your life. You just think about your happiest moments. You just think about the happiest things. You just think about the wonderful things. You are the person with wonderful skills. You are the person with wonderful talents. You just think about them all. You just think about them all. You just think about them all. Maintain the smile on your face. Maintain the smile on your face. Now think about your head. Think about your head. Now think about your hair. Think about your hair. Now little slowly calm down. Think about your forehead. Think about your forehead. Now think about your eyes. Think about your eyes. Your eyes are little beautiful. Your eyes are little small flowers. You just think about your eyes. How beautiful they are. Now just think about your nose. Think about your nose. Your nose is a wonderful creation in the earth. Your nose is a wonderful creation in the earth. It can give you complete life. Breathe in. Breathe in as much as you can. Breathe out. Breathe in as much as you can. Deep breathe in and breathe out. Deep breathe in and breathe out. If possible, try to breathe in and hold for a few seconds and release. If possible, breathe in, hold for a few seconds and release. Breathe in, breathe out. Breathe in, breathe out. Now think about your mouth. Think about your mouth. This is the actual source of your whole bodies. This is the actual source for your whole lifestyle. So now onwards, you are going to decide that you are going to use your mouth wisely. You are going to decide that you are going to use your mouth wisely. You made a promise to yourself. Make a promise to yourself. Make a promise to yourself. Today onwards, now onwards, I'm going to use my mouth. I'm going to use my mouth wisely. I'm going to use my mouth wisely. I'm not going to lead by my mouth. I'm not going to lead by my mouth, but I'm going to lead my mouth. I'm going to lead my mouth. I'm the master of my mouth. I'm the master of my mouth. Now just come down. Think about your neck. Think about your neck. Observe the whole structure of your neck. Observe the whole structure of your neck. It is the connection between your body to head. It is the connection between your body to head. Observe the structure. Observe the sounds in your neck. While you are breathing in, observe the sounds. While you are breathing out, observe your sounds. While you are breathing in, observe the sounds. While you are breathing out, observe the sounds. Superb. Now come to a little down, come down, little down. Now focus on your chest. Focus on your chest. Observe your lungs. Observe your heart. Observe your hands. Observe your shoulders. Focus. Deep focus on your lungs. Deep focus on your blood. Deep focus on your heart. Breathe in. Observe how much your lungs are expanding. Observe how much your lungs are expanding. Observe how much oxygen your lungs are bringing to your heart. Observe it. Observe it. Breathe in, breathe out. One more deep breathe in, breathe out. Deep breathe in, breathe out. Now completely come down to your stomach. Completely come down to your stomach. Completely come down to stomach. Now observe your stomach. Now observe your stomach. Your stomach has a lot of internal organs. Your stomach has a lot of internal organs, wonderful organs, which can give you complete healthy life. Your stomach has a wonderful capability to give you a wonderful healthy life. Think about it. Think about it. Feel relaxed. Feel relaxed. Now little come down. Little come down to your thighs. Little come down to your thighs. Little come down to your thighs. Now focus on thighs. Focus on thighs. Focus on thighs. Feel the thighs. Feel the thighs. Now little go down to knees. Little go down to knees. Think about your knees. Think about your knees. Think about your knees. Now come down. Little come down. Now focus on your legs. Now focus on your legs. Focus on your feet. Focus on your feet. Focus on your feet. Focus on your feet. Try to observe each toe of your feet. Try to observe each toe of your feet. Try to focus on each toe of your feet. Focus on that. Focus on that. Focus on that. Now, complete body focus. Complete body focus. Now you are going to see. Now you are going to see your whole body. Now you are going to see the whole body. Just come out of your body and see your body. Come out of your body and observe your body, how it is. Observe your body. Observe your body. Now enter into your body. Enter into your body. Observe from head to toe. Observe from head to toe. Observe from head to toe. Now completely focus on breathing. Now completely focus on breathing. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Take a deep breathe in, breathe out. Take a breathe, breathe out. Take a deep breathe in, breathe out. Now relax, 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 relax. Now try to make aware of your body. Try to aware of your body. Try to make aware of your body. Try to make aware of your body. Try to make aware of your body. All right. Don't open the eyes directly. Don't open the eyes directly. Relax. The people who already lie down, you can turn to your left side. You can turn to your left side. Use your right hand as the support to sit. Use your right hand for support to sit. Those who already sat down, just make conscious about your body. Just aware of your body. Aware of your body. Aware of your body. Now slowly you can open your eyes. Slowly and gradually you can open your eyes. Slowly and gradually you can open your eyes. Slowly, gradually you can open your eyes. You can open your eyes. You can open your eyes.